Hi guys, this is Dr. Chang from AMH Pasadena. Thanks for tuning in. This is Max. Hey, hi Max. Hi Max. He is 14 years old and mom kind of started noticing like, hey doc, Max is being kind of restless at night. You know, he is waking up a lot during the night. Everybody. Yeah, good job, buddy. Sometimes staring at spaces, kind of having difficulty going into like tight corners. So one of the things that we can talk about in our geriatric patients when they get to 11 years old, 14 years old, is that they do have a natural, normal dysfunction of their brain slowing down and denaturing. It's called canine cognitive dysfunction, similar to dementia in people. So kind of big pillars that you notice is DISHA. And what that means is disorientation, difficulty with interactions, their sleep cycle, house soiling, and activity. There's a really nice handout from Purina Institute that has a really nice kind of sheet about all the things that you'll see. And so these are just kind of things that we talk about when our dogs are getting older to that age. If you notice them, you know, having a difficult sleep cycle, or they're restless, or they're having to wake up very often. They sometimes will even stare at the doors, but not where it opens, but at the door hinges too. These are things that's just a natural process. You know, we want to make sure everything else is good, of course, when you bring him for a physical exam. But things that we can talk about is making sure that he has a really good schedule, having mental stimulation. He's really anxious. There are medications to help with that. There are some supplements in certain diets as well too. So these are things that we kind of look out for, especially in an older patient. But that is just part of the aging process in our very sweet dogs. In case you're wondering, hey doc, how do we test for doggy dementia? One of the first things you want to make sure is that there's no underlying cause. You know, if you're seeing him stare into spaces or he's circling, you want to make sure it's not neurologic, you know, during a neurologic exam. If he's house soiling or he's peeing in places he's not supposed to, we want to make sure that we do an annual blood work to make sure there's no underlying urinary issues or kidney issues or things of that nature for medical reason that would cause these signs. When your dog gets to that older age, they are still just as lovable, don't you worry. A lot of our older patients might need to come in once a year, sometimes twice a year, especially if they have chronic diseases that need to be managed. If you ever want to have your loved one or your loved dog or cat have a physical checkup, just give us a call. We're here for you.